for our pregos out there, our pregnant members.
Yes.
Or soon to be pregnant members.
Yeah.
um, what are the things to watch out for while, let's say, I don't even know I don't know trimesters or nothing about that, but let's say I'm trying to work out, but how can I not injure myself or injure my baby while exercising?
So the main thing to remember is pregnant women have a lot of hormones going on, and what those hormones do, they make all your ligaments loose. So, and it's by design, because when the baby comes out, you don't want those ligaments to be nice and firm, because it's going to be harder to give birth to a child.
Right.
The pelvis has to widen to allow the baby to come through. So these hormones are there they cause laxity, which causes instability, but it's temporary until the woman's done breastfeeding and, they're through being pregnant. But while they're pregnant, they run the risk of spraining ankles, spraining knees, doing things that might sprain their ligaments that normally would be intact. So the biggest thing for them would be, making sure they keep their strength up, obviously not lifting excessively heavy weights, but there's no reason you should stop exercising just because you're pregnant. I mean, obviously in the last trimester, you want to be mindful because you're probably going to be uncomfortable. You have all this weight, you might have swollen legs, things like that. But it's important to keep your stability, working on balance training. I would say that's a big one, just because your balance system's off because of these ligaments being lax. Balance, the way it works is you have your vision, you have your vestibular system, and you have your proprioceptive system. And, your proprioceptive system is the one that gets disrupted when you're pregnant, because all these cells inside your ligaments, those are they give you body awareness. Where am I? If I close my eyes, I can still walk around. I know where my body is because I can feel where my body is based on these cells in my ligaments. But women that are pregnant, these can be disrupted because of the laxity. Okay. So my biggest suggestion for women is keep your strength up and work on your balance to make sure you don't injure yourself. And again, you're not going to injure your baby doing regular exercise, but I wouldn't take on like heavy weight training when I start out being pregnant, Yeah. I mean? Not that I'm pregnant, but
Yeah. I mean. Well, I had seen a it was I don't know if it was viral video, but it was a video on social media. This lady, she had cleaned and jerked a away for a baby reveal.
Okay.
So I was just assuming.
Did she have a lot of weight, or was it just a bar?
No, she didn't look overweight.
No. I'm saying, was she lifting a lot of weight?
No.
Okay. Yeah, I mean, she should be fine.
No, okay.
Yeah. But again, if she's somebody that normally lifts weights and was doing so prior to being pregnant,
right? Yeah,
I'm assuming she was strong already, then she's most likely fine. And she's just lifting the bar. But again, if my wife's pregnant, I'd probably be hesitant to say, yeah, do some heavy weight training at this point. You should do some strength training, but I wouldn't be doing Olympic lifts. At least that's my opinion. That's just my preference, but there's no reason. There's nothing in the literature that says you can't weight train while pregnant.